Our topic for today is assessment and interpretation of heart rate and pulse. Heart rate is the number of times the heart contracts in a given period. It is the beats per minute, and a normal heart rate is 60 to 100 beats per minute.
Yes, and so first things first, pulse does not equal heart rate according to an article we found. And so pulse is measured in three things: the heart rate, which is pulsations or frequency per minute; rhythm, which is the pattern of pulsations and the intervals between, and it's measured by regular or irregular; and then the quality, which is the amount of force created by the ejected blood volume against the arterial wall during ventricular contraction.
And then more on pulse quality, we have this chart here. 0 would be absent pulse, 1 plus is a thready pulse, 2 plus is a weak pulse, 3 plus is a normal pulse, and 4 plus is bounding. Then we have factors influencing heart rate. We have age, gender, activity, and environment. And we found a study that was done on a total of 1,172 patients that were 40 or older, and they found that heart rate tended to decrease with age, and women had higher values of mean heart rate regardless of their age group.
Also, factors such as medications influence heart rate. So albuterol is a medicine for asthma. It increases the heart rate, and beta blockers decrease the heart rate. Also, stress and emotions influence heart rate, and systematic or local heat. And a special consideration is position. So the position we put our patients in, whether they're standing or in supine or laying down or sitting, can affect the heart rate.
Okay, so now we're going to show you the different sites you can take pulses at. So when you're taking pulse, you want to use 2 fingers, usually your index finger in your middle. You want to avoid using your thumb because it has its own pulse. So we'll be going from the top to the bottom of the body. So I'll be starting with her carotid pulse, which is on the neck, on your sternocleidomastoid. And when you're taking pulse, you want to do it for a whole minute, and then you can read the pulse. So this was the carotid. And then down the arm, we have the brachial pulse. So I'd want my patient to make a fist, and then between the triceps and the biceps is where I'll be taking this pulse. So I'll show it here, right here. And again, that 1 minute. And then going down the arm, we have the radial pulse on the lateral side of the wrist, where your thumb is. And a little weaker pulse on the medial side is called the ulnar pulse. We don't take that as often, but it's still there as an option.
Okay, and then we have the femoral pulse, which you would find between the anterior superior iliac spine and the pubic tubercle. So you would go down the middle, find that pulse. And next we would have the popliteal pulse, which would be behind the knee, preferably not over clothing. And this one's going to be more medial as well. This one's harder to find, so if you can't find it this way, you can have the patient flip over. You'll rest their foot against your shoulder, and you can find it like this. And then we have the posterior tibial pulse, which is going to be here. You will find the medial malleolus. And then we have the dorsal pedis, which would be on top of the foot. It's going to be between the first and second metatarsal.
So in conclusion, heart rate and pulse are used as important vital signs as physical therapists to make sure our patients are ready for therapy. Some indications to use it are before, after, and during exercises to ensure our patients are at a safe level of heart rate. And also some precautions to look out for. You don't want to press too hard, and you also don't want to take a pulse where there's any wounds or blood you can see. But other than that, thank you for watching.
Thank you.